If you guys can take your seats, please. Catherine Anderson, we're going to start now. Yeah, come in with me.
Okay, everybody. Time to get seated again, please.
You did really well. Yeah, let's go out, but somewhere we can talk.
Yeah, like a really quiet Vietnamese.
I don't know. Talk with the group. There's a few of us. Yes.
And it's
Okay. All right. Well, we got a few people want to do it, so good. After this, we'll chat.
Can I just, with that mic? They turned it off.
Do you want to give her mic so she can just do the introduction?
I can just be loud.
Just give her a mic. He's going to give you a mic. He's giving you. It's still.
It's not live.
No. No. It was. Here it is. It's on.
Okay. All right. Those of you who were here this morning, let me take a running start at that again. Those of you who are here this morning know that you are listening next, not only to the organizer of the symposium in Vancouver, the IFS, but also to an award-winning speaker.
That's right.
Since we presented the first Yosan University Award for Integrative Excellence this morning.
Thank you for that.
As I've said about the other speakers, you can read more about Dr. Brown in your program notes, and I will leave the rest of the time for him to be discussing PCOS with you. Thanks.
Thank you, and thank you for having me. So I wear the hat of the chair of the Integrated Fertility Symposium Healthy Seminars. Some of you may not know, but I'm also a practitioner. My clinic is in Vancouver, British Columbia, Canada. It's called AcuBalance Wellness Center, and I'm regulated there as a doctor of Chinese medicine. And we're the first clinic to focus on reproductive health, and our clinic was responsible for getting acupuncturists in IVF clinics in Vancouver. Back in the day, in 2002, when we started that process with them, literally threw us out, and now every clinic has one, and the clinic that we work with built our space. So from 2000 to now, there's been a massive paradigm shift, I should say. So I'm going to share with you kind of my approach to polycystic ovarian syndrome that we do at AcuBalance. And you should know PCOS, it's one of the leading causes of ovulatory disorders, and I'm going to share my 19 plus years of experience of treating this ovulatory disorder and using an integrative approach as well. So for your patients to follow your recommendations, they really have to understand the why behind the how. The how is what we're going to ask them to do. Lifestyle changes, going for yoga classes, diet, drink these herbs, come for acupuncture. That's the how. But if they don't get the why, it's really difficult for them to be motivated and to follow through on that. So what I want to do, because there are so many great talks on PCOS that I've attended, I want to give you my clinical pearls, and I want to tie into it my approach, because you will find as you work in reproductive health and you go to lectures and you gain your experience that you probably know a lot what I'm going to share today. I bet a lot of it won't be so new, but how I communicate, Ricky was talking about the language I use with the patients, the metaphors, so it lands, as Brenda's talking about, into the heart to give them hope so they get the why, so they get to do the how. And so I'm going to share that in my presentation, which I don't think you see in a lot of lectures. So that's where, like I could do my talk on how to treat PCOS, I just need 2 slides, which are in here. But I'm going to sandwich it with some stuff before and after, so you too will get the why behind the how, so you'll be inspired to use this in your practice as well. So I share when patients come in with PCOS, diagnosis, ovulatory disorders, I let them know that, my goal for you is healthy baby. And healthy baby equals healthy egg, plus healthy sperm, plus healthy uterine environment. And I use the word loosely. I don't care whether that happens in the bedroom or in the lab. My priority is healthy baby. Now, like you, if you're the couple in front of me, it's a better feather in our cap. I want the natural too. I want the bedroom for you. However, some people will need things like IVF or donor eggs. And to me, that is the way to go if it's going to give us the healthy baby. Because at the end of the day, I want healthy baby, healthy mom, and if there's a man in the picture, healthy father. So we discussed the healthy baby approach. And I just want to start off with a case study that I'm going to talk about later on. But why I think this condition, when women are diagnosed with polycystic ovarian syndrome, why I think it's so important that they see people like us before they do ART, like IVS, superovulations, Clomid, letrozole. And it comes back to this healthy baby approach. We call it Jing in Chinese medicine, right? The healthy baby approach, we know epigenetically that the health of the egg and the sperm, those 3 months leading up to conception, the health of the man and the sperm, impacts the health blueprint of the future child. The Jing, the essence. So this is why we want to work with them before. So I'm going to give you one of many cases I've seen in my practice with ovulatory disorders such as PCOS, our approach. But here's one, but we have lots of these. Age 35. She had 5 ART cycles, ART assisted reproductive techniques. She did a Clomid cycle, ovulation drug, not successful. She did 2 medicated IUIs with Puragon, so superovulation. The same drugs they use for IVF, just at a lower dosage. Not successful. Then she did 2 IVFs. The first IVF, chemical pregnancy. Second IVF did not work. And I want to just share her response to the IVF. So her first IVF, 17 eggs retrieved. Out of the 17, 4 fertilized, 1 made it to blastocyst day 5, and that resulted in the chemical pregnancy that miscarried. Never made it to the heartbeat. Second IVF, she had 17 the first time, she had 13 fertilized, 4 fertilized in the first one. Second one, she had 13 fertilized. They did ICSI this time, injected the sperm into the egg. 3 made it to day 5 blastocyst. They transferred 2 on day 5, no pregnancy. 1 still on ice, 1 frozen. She comes to our clinic and says, I would like you to support me on my frozen embryo transfer. I'm hoping you can help me and create a receptive environment. Now, I'm going to continue this case later on in the lecture and tell you what happened. What I'm going to share with you is the discussion I had with this patient and why what we do can really benefit these women, give them hope, but educated hope, and why it's so important because our goal is healthy baby. You notice in these IVF cycles, lots of eggs, but not a lot of embryos. None making it to day 5. Why? The environment in which these follicles are maturing in is suboptimal because of the diagnosis of PCOS. A lot of them have this hormonal imbalance, so the environment is not optimal. So the egg is not reaching its peak fertility potential. And this highly androgenic male hormone-dominated environment in a lot of women with PCOS is not receptive to embryo implantation. So IVF is a great tool to get the egg and sperm together, but it doesn't do a lot or enough to improve egg quality, to get that egg to its peak fertility potential and uterine receptivity. And this is where we play integration. This is where we're a great tool together. So why we want to help these women? We want healthy baby, we want healthy mom. Look at some of the symptoms or conditions that women diagnosed with PCOS can develop when they're pregnant. Excessive weight gain during pregnancy, gestational diabetes, the baby's being large, so needing C-section, which can lead to other complications, pregnancy-induced hypertension, unfavorable lipid patterns, preeclampsia,